I am Dr. S.K. Sharma at Jeewan Hospital Pusa Road. I am trained in internal medicine and gastroenterology from Postgraduate Institute of Medical Education Research, Chandigarh. I've got more than 40 years of experience in gastroenterology. The term gastroenterology is loosely applied to diseases of the digestive systems. However, it encompasses many more specialties or subspecialties than is apparent. For example, it consists of mainly 4 divisions. 1. Gastroenterology, which means diseases of the food pipe, stomach and intestines. 2. Hepatology, that means diseases of the liver. 3. Biology, which means diseases of the gallbladder and bile ducts. And last but not the least, pancreatology means diseases of the pancreas. Most of the time patients come to us with digestive symptoms and we diagnose them and we take the help of 2 more specialties or methods of investigation, that is ultrasound and CT scan or MRI. Most of the cases we are able to diagnose with the help of our clinical judgment and these 2 investigations besides routine blood test and urine stool test. However, an important component of gastroenterology is something called endoscopy. Endo means inside, scopy means to see. Here we have a special tube which is provided with a camera and a light source which illuminates the inside of the intestine. So it's just like riding through a tunnel on a slow moving boat and visualizing all around. So this endoscope has turned out to be a boon for gastroenterologists because with the help of the endoscope, not only we can see inside the intestine which was otherwise inaccessible to us, but also do some treatments to the patient, and I'll come to that in a little while. Now endoscopy is basically of 2 types. One is called diagnostic endoscopy, where we just put the scope in, visualize and make a diagnosis after seeing the lesion. Sometimes we can take pieces of the lesion like biopsy or scraping from the lesion called cytology and make a proper diagnosis for the patient. Another advancement of endoscopy has been in terms of diagnostics, that we have attached a ultrasound on the tip of the camera of the endoscope, so that when we go inside with the help of endoscope, we take the ultrasound inside the body and from there we examine various organs like liver, stomach and so. By being nearer to these organs, we are able to have a better view of the inside of the stomach. A further advancement has been that we have attached a sort of microscope on the tip of the endoscope, by which when we go in, we take this thing along and examine the tissues in greater and minuter detail than we would otherwise see with the naked eye. This is sort of a microscope inside your stomach or intestine. So these 2 developments, first is called endosonography and second is called confocal endoscopy or confocal laser endoscopy to be precise. With the help of these 2 investigations, we are able to make most of the diagnosis correctly. But the real impact of endoscopy has come with what is called therapeutic endoscopy or interventional endoscopy. Here we not only go in, see the lesion and try to correct it or do something about the finding that we have. The commonest use of endoscope for therapeutic purposes is in patients who are bleeding from inside their intestine or stomach. Here we have provision that with the help of the endoscope, we can either inject into the lesion to stop the bleeding, or we can clip the lesion with special clips, or we can even burn the lesion to stop the bleeding. And this single procedure has saved millions of lives world over with the help of the endoscope. Another thing that we use endoscope very commonly is when young children particularly ingest foreign bodies like coins, like batteries and so on. And we are able to remove them by just putting the endoscope in and retrieving them with the help of special instruments. So you can avoid a major surgery in a child who has by accident or by intention swallowed a foreign body. Another thing which we can do with the help of the endoscope is that sometimes when we go inside we find the whole thing is narrowed. We cannot take our scope beyond the area of narrowing. This can happen because of damage to the intestine or the food pipe, or sometimes because of cancer. With the help of the endoscope, we can open this up by dilating the food pipe or the intestine, or just putting a stent inside so that we make a passage through the intestine, food pipe and so on. A major advancement in terms of therapeutics has come for the removal of the gallbladder stones, which have gone down from their main place of gallbladder into the common bile duct. They go down and block the duct and cause jaundice. This can be sometimes life-threatening. With the help of the endoscope, we can reach the area where the stone is stuck. We can just cut open that area, remove the stone and come out. So this simple procedure of endoscopic sphincterotomy, as we call it, can take care of the stones which are impacted in the lower part of the bile duct. And this can be followed later on at elective time for surgery as far as gallbladder is concerned. Last but not the least, we have made tremendous advancements in the field of treatment of cancers with the help of endoscope. Whenever there is a growth inside the gastrointestinal tract, we can not only diagnose it with the help of endoscope. If the lesion is not very malignant or spread out, we can remove this lesion with the help of the endoscope. This can be done with the help of some snares, some dissections and special instruments by which we can remove the lesion without cutting up open the patient. So this advancement of endoscopic resection of the tumors from within the intestine has really avoided major surgeries in many patients who have been detected at an early stage of cancer. So endoscopy has really made a tremendous difference, and we have a state-of-the-art endoscopy unit in our hospital and we are proud of it. Last but not the least, anything is done to the patient for treating is very important, but more important is to prevent the disease. So we have a lot of emphasis on prevention of gastrointestinal diseases, for which basically we advise the patient regarding diseases of the intestine and liver, ask them to adopt a healthy lifestyle, avoid taking alcohol and smoking, which are, we know, are responsible for the liver as well as cancer diseases. We ask the patient not to indulge in promiscuous behavior or drug abuse like intravenous drug abuse, because they can spread hepatitis. And of course, we can provide them vaccination for hepatitis A and B to prevent the disease. Remember, prevention is always better than cure, and a stitch in time saves time. Thank you so very much.